Today we're going to talk about effective delegation and supervision. How do we achieve that? ADPI, of course. First, we assess what it is. Delegation is the transfer of responsibility and performance of an activity from one individual to another. It's not to be confused with assignment, which is the distribution of work that is delegated to each staff member to be responsible for during a given work period. And supervision is the active process of directing, guiding, and influencing an individual's performance of a task. So this is where we, as a leader, you look at your team and yourself, and you ensure they corroborate the mission of the unit and the company. Next, you get to the nitty-gritty and diagnose any issues you've identified. You want to take time to note strengths and weaknesses in the operation, both internally and externally. What are the contributing factors? What areas are working? What areas can be improved upon? Several main challenges that nurses face in delegating, and those will be discussed a little later on. Next comes the fun part too, planning. It's all about new ideas and innovations and creating a desirable work culture. Be sure to include the 5 rights to avoid high-risk scenarios, the right tasks, circumstance, people, communication, and means of supervision. The priority always is patient safety and quality of care, though. Cherry on the sundae is the happy and efficient work environment. So next, you implement any new methods that you came up with, and this can be just as fun as planning. It's also a very critical step in the process because it's about follow through and building those trusting relationships. You want to lead by example, be available and present, be the second set of hands somebody needs. Consistency is key, but this is where you'll see the fruits of your labor. Finally, you get to evaluate your design and essentially reassess everything. The nursing formula is a consecutive and concurrent process, so be sure to review the outcomes with staff and patients to recognize areas of success or possible shortfalls. Ask, are things running smoothly? Are the patients comfortable? Everything's safe, happy, productive. Most valuable tool in every aspect of life is, communication, communication, communication. A little bit is going to go a very long way.
In this portion of the presentation, I will be talking about the issues of delegation and supervision in the clinical setting. Currently, there are several influencing factors that may lead to ineffective delegation and supervision within the healthcare field. First, there is the Patient Protection and Affordable Care Act that has allowed more people to have health insurance, so more people are seeking care, leading to a higher nurse-patient ratio. Patients are also now demanding that care be provided in an effective and efficient manner because they are paying a higher copay. This has led to a strong focus on safety and quality, which requires healthcare systems to make rapid changes for continual improvement. Then there are the cost-cutting measures put in place by hospitals due to reduced reimbursements from Medicaid, Medicare, and private insurance companies. There has also been a sharp increase in the cost of providing care due to patients having severe illnesses that require complex treatments and advanced medical technology. So one way to address these issues is to increase the cost effectiveness of providing patient care. This can be done with the use of unlicensed assistive personnel, or UAPs. So how does this affect delegation and supervision? Well, as the use of UAPs increases, the RN is obligated to delegate more tasks to people who do not have clearly defined parameters for education, training, job responsibilities, and role limitations. Thus, the RN must learn new ways of managing and delegating tasks. This can be a complex problem for many nurses, especially for those who are inexperienced, because there may be a possibility of not fully understanding the delegation process, having a fear of being disliked or making a mistake, being inexperienced in working with LPNs or UAPs, lack of confidence or appropriate communication with staff, not providing enough or honest feedback to the person being delegated, not intervening immediately during unsafe activities or performances, and not being readily available to provide appropriate supervision. These issues can severely compromise the effective delegation and supervision process because failure can lead to care being missed, duplicated, and/or being incorrectly performed.
So why is effective delegation and supervision important? Effective delegation and supervision has shown to improve efficiency, productivity, and time management of an organization. It also improves communication and develops trust amongst team members. It also allows others the ability to learn and develop new skills, and it significantly improves patient care and safety outcomes. One way to improve delegation is to create and schedule meetings to evaluate each individual's knowledge and skill set, allow staff members an opportunity to express their concerns, and discuss any improvements and what input they may have. How can we promote change to enhance effective delegation and supervision? It starts with building trust, and this is done by showing value in staff, promoting an open atmosphere so that staff feel they are able to express their concerns, provide their opinions on what is working and what is not without fearing repercussions. Involving staff members in the change process, setting aside times to evaluate each individual's knowledge and skill set so appropriate tasks are assigned. Keeping workloads fair to prevent staff from getting overwhelmed, which can lead to medication error, patient injury, and staff burnout. These changes promote building trust and improving communication, both of which play critical roles in ensuring quality patient care and safety outcomes. Establishing trust and providing open communication with staff members also leads to a higher job performance, thus leading to a higher quality level of patient care, which is generally an organization's number one goal. So now let's discuss the interventions that can assist making these changes that are necessary to promote effective delegation and supervision.
Essential interventions for effective delegation and supervision include knowledge of the delegatee's skill level. So the delegating nurse wants to know the skill level of the delegatee and competence level. Some people work in their competence level while others are overachievers, and then there's also some underachievers. So knowing what skill level the delegatee is will help the nurse match a task with the delegatee. Another intervention is using the nursing process. Using the nursing process is important for delegation because we also have to assess, plan, implement, evaluate. You want to evaluate the task. Did they meet the skill level? What was the outcome of the task? Do they need teaching? So the nursing process is needed in every situation and also is needed in the delegation process. Another intervention is knowing the legal job description. So the delegating nurse wants to know needs to know if the task they're asking of the delegatee is within the scope of practice, because the nurse does not want to assign a task that is without the scope of practice. So knowledge of the legal job description is very important when it comes to delegation as well. Another intervention is implementing trust and understanding. It's a fundamental of effective delegation is trust, and it goes vice versa. So the delegating nurse needs to be able to trust the delegatee to perform a certain task or skill, and trust that they are competent enough to do it, and also that they have the confidence to do so. And vice versa, the delegatee should trust that the nurse is not going to put upon them something that is out of their scope of practice or something that is out of their level of skill. Also, it has been shown that lack of trust is the most common barrier in effective delegation. So building trust also has been proven to have a positive impact on the healthcare system and the team as well as the patient. Other interventions that are important to include when delegating are giving feedback, promoting self-confidence, and teaching. These are all important because you want to make sure that the delegatee is confident enough to do so, and if they're not, they might just have low confidence, but you know they can do the task. So it's important to promote confidence, especially if they are at the level to do so. You also want to give feedback, keep communication open, give feedback, whether it's constructive, positive, and teaching if teaching needs to be done.
And the last step is going to be evaluating. So things that you're going to want to evaluate will include barriers, communication, trust and cooperation, and performance. For barriers, you're going to want to identify things like lack of confidence or lack of knowledge. And identifying these will be able to determine the capacity of the staff and what they can handle and how much workload they can handle. With communication, the RN is going to need to know exactly what needs to be done and what the expected outcomes are in regards to patient goals, and they need to be able to communicate that efficiently. With trust and cooperation, the RN needs to avoid blaming and criticizing if any issues arise, and instead looking for the root causes of these issues. These can include inadequate training, or maybe the workload is too heavy. And then with performance, always provide feedback based on the evaluation of their performance. And this is going to also include positive feedback for good performance. This will increase their confidence. And then also addressing any inappropriate performance. And this is to just always prioritize patient safety at all times. So some other ways that staff compliance can be evaluated is by having voluntary and mandatory meetings and giving the staff freedom to participate. This can open up a discussion in regards to maybe any issues that may be going on that can be easily resolved just through communication. And then also performing regular evaluations as mentioned previously. This allows for a deeper connection with the staff, and then also it allows for any issues to be identified and addressed. And then as mentioned before, it just helps everybody be on the same page. And some other ways to ensure staff compliance are just being consistent with communication and information, and then also asking for feedback from the staff, maybe to identify any leadership style compatibility issues that may be going on and that may need to be addressed in order for things to work more efficiently.